Sometimes people have difficulty talking about their pain. Sometimes people may not even consider it a pain. They might consider it a discomfort or hurt or just an ache. Do those words make resonate with you? Maybe some word that you may use to describe your pain, and then use that to help. Does that help you at all? If not, some people think that it's better to just, suffer through the pain. I know that in some cultures it's believed that pain is a part of suffering that people need to go through to get to a better place, or to get through an illness that is instrumental in them getting through. However, my concern is that if this pain is affecting your ability to live and is affecting your quality of life, then to me, I would like to help treat it instead. Sometimes people feel stoic. They don't want to admit to being in pain just because it would be admitting to a weakness. Honestly, it's not a weakness. Sometimes our sickness can cause us pain. Sometimes treatments can cause us pain. We should acknowledge it, try to manage it the best way we can, and continue to live our lives as best as possible. Does any of this help you to share with me what sort of suffering or discomfort or hurt you're going through right now? I would want to hear from you, as your doctor managing your pain or trying to help you with it, is to see what, if anything, that you have tried before that has made it better. So some patients in your condition may try some heat or some ice to the area. Some other people may try some creams that are available over the counter, like aspirin or other like Motrin-based creams. Do I believe in taking medications on a regular basis? That's hard. On introspection, I found that I'm not so keen on taking medications unless the pain is disabling. At which point then I do. And I've also realized that disabling is a threshold that's very different for patients. So what's disabling for me could be very tolerable to another person, and what's disabling for them would be fine for me. That's why I see that it's a very personal experience. So while I can give you examples of how, as I just said, how I've managed my pain, it may not apply to everyone, definitely. My first question is, how much time of the day do you spend in bed? Which, if it is a lot, then our muscles can get weaker. And so for that reason, if you're spending a lot, say 8 to 10 hours and up to 12 hours in bed, I would urge you to take things a little bit slow. Plus, if you have been, sick, very sick recently, it can take a toll on your body. So if you're in the hospital, we should get you to see a physical therapist who can see how well you're balancing yourself on your feet, how far can you walk safely, and then feel free to walk in the hospital corridor. Some people push their IV poles and that's their walking stick. Keep on walking. Other times you can get an aide to help you who will push the IV pole for you while you have your walker, if the physical therapist thinks that you need to go for a walk with a walker. Going outside, absolutely. The weather is not the greatest at this point, but if there's an accessible park next to your house and you feel like taking a small walk even down the driveway or into the park, that is great for your own feeling of well-being and being able to do things that you like. Getting diagnosed with cancer can be pretty hard. Since we have started aggressively screening for cancer, cancer has become more of a mainstream word. At the same time, there are a lot of people who still want to avoid using that word because of the fear that they associate with it. The advice that I have drawn from other patients who have coped with it successfully is that, on the one hand, a lot of people tend to draw meaning from this experience. The strongest piece of advice that I have heard from people who have successfully gone through that is not to let it become somebody's identity. So, for instance, that the fact that a woman suffers from breast cancer and she's a breast cancer survivor, it is a very static term. Moving on from that, what she has learned, she draws meaning from that experience, and that maybe changes her into something more positive, but it is not her the identity for her rest of her life. She continues to identify with things that have held meaning to her, other things that have held meaning to her. So my advice is that maybe to think about, you are riding in a bus and you meet a stranger, and the stranger asks you that, my bus stop is coming up very soon. Can you tell me what 3 things you could identify yourself with? Think about that answer. The 3 things that come to your mind are the 3 things that are important. Necessarily being a survivor of cancer may not be your entire identity. It'll still give you meaning, but may not be your entire identity. Finding meaning is probably the most difficult thing in this entire process. And getting the answer to the question of why me, and moving on from that, dealing with the treatments, and keeping things that are important to you in focus for your life is probably the most important thing we can do at this time. And as healthcare providers, we would like to help you with that. So I would like to know, as your healthcare provider, what is it that is important to you and how I can help you achieve that.